The COVID-19 pandemic has caused a mental health crisis in the United States, with almost 41% of Americans struggling with mental health issues. Compounding the crisis has been the very real impact of social injustice on our mental health. The Women's Center is experiencing a significant increased need for our mission-critical advocacy services for victims of domestic violence and reduced-fee mental health services for our community's most disadvantaged residents. As the coronavirus continues to spread across the United States and governments respond with social control measures, victims of domestic violence face a double threat: a deadly virus outside and an abuser at home. In these unprecedented times, victims of domestic violence are forced to isolate themselves with their perpetrators, which cuts them off from their support systems they have in place to get help or escape. Victims would normally wait for their abuser to go to work, secretly reach out to friends and family, and look for openings when they do not have childcare obligations. Since the COVID-19 crisis, these options are no longer available to them, leaving them subject to increased severity and frequency of abuse. Women's Center clients are reporting an increase in physical and psychological abuse, family suffering, and even death. We have seen over 40% increase in domestic violence counseling sessions and an increase in wait times to over 1 year. Social isolation, fear, stress, and loss of employment are leaving a devastating impact in our communities. Mental health conditions brought on by the pandemic are disproportionately affecting specific populations, especially low-income, Black and Hispanic families, women, and in particular, women of color. Since the start of COVID-19, the center has experienced an increase in requests for our sliding scale mental health services that help individuals, couples, and families who lack financial resources to meet basic needs. These disadvantaged clients are experiencing eviction, trauma, financial stress, grief, loss of employment, marital issues, and substance abuse, resulting in an increase in anxiety, depression, and other mental illness. The Women's Center has seen a 20% increase in mental health services since COVID started. The Women's Center is rising to the challenges presented by this historical year and has had made necessary changes so we can meet the overwhelming emotional toll facing our community. Our sliding scale mental health services are more important than ever. Last spring, we quickly adjusted our services to virtual platforms so we could continue to meet our clients while protecting the health and safety of our community. We are focusing on communities of color and expanding our care capability. Our 46-year vision to make sure no one is turned away from the center due to an inability to pay has become more vital than ever. Sadly, the stress and pain will not end when the risk to life subsides. Experts are predicting the spike we are seeing in anxiety and depression to continue into the foreseeable future. We want to be able to remain a community mental health resource to help anyone struggling now or later, but we need your support. You have the opportunity to bring hope to others in a deeply meaningful way. Please show your support tonight, whether that's by making a donation or participating in our exciting auction, to ensure that the Women's Center will always be around to provide connection and healing to those who need it most. And please, these are challenging times, but we are going to get through them together. Practice patience and compassion, not only with others, but with yourself. And know that we are here to help you get through this.